So what you're about to watch is the discussion I had with Dr. Ken Berry when I did a live on Instagram. And we discussed so many different topics: macular degeneration, diabetes, and I brought up a lot of the questions that my followers had asked to me and to Dr. Berry to discuss. So here it is, and I hope you enjoy it.
Hi.
Hey, how's it going?
Good. It's so great to speak with you face to face finally.
Absolutely. It's a pleasure to be here. How have you been?
Oh, really, really good. I am taking all this time to do a lot of research and learning, and it's actually been, I guess, really eye-opening for me to be able to spend time doing things that I normally don't have time to do. So how are you?
It's very valuable, but very often doctors just don't have time to sit down and reread things they read years ago or to read new things. We just don't have time for that.
Yeah. And, I want to thank you so much for all the content you put out, because day in and day out with me and with my patients, that I am trying to educate them on macular degeneration and trying to convince people that this really truly is diet related and that they can make a change for themselves. And this is a sight threatening, disease, and this is serious. And people look at me like I have two heads when I tell them they have to give up chocolate and bread and pasta. Yeah. And I've actually made a specific separate handout for my patients that list your links to your YouTube videos, and I have a separate one for diabetes. And it's just so helpful to have that resource there, because I really, can't spend all the time that I would love to in the exam room. And I'm so passionate about getting the word out, and I just want to pour everything into the conversation with them to try to get through to them. And unfortunately, with the way the medical system is now, I don't have, an hour to spend with everybody, that. So I really want to thank you so much, because the content is great. And my patients come back for their 6-month follow-ups, and some of them have tears in their eyes that are just so thankful that, I opened their eyes and no other physician has said to them what I've said to them, and that I've given them hope. And some physicians have told the diabetics, you will be diabetic for the rest of your life. And I say to the patient, no, look at my head shaking. No, that's not true. Good. And I said, that is a lie your doctor has told you. Yeah. I said, and there's a great book out about that.
And I don't think it's a conspiracy. I don't think it's evil. I think many doctors just don't realize that diabetes, prediabetes, is completely preventable and completely reversible. And I think many opticians and ophthalmologists, I don't think they understand that macular degeneration is completely preventable, 100%, no argument, and perhaps even partially reversible even after you have a little bit of the damage. They still think that's woo-woo or magic. They don't think that's actually true, because they haven't sat down and actually looked at the things you and I have looked at, and read the things you and I have read, and seen the results of people literally transforming their lives back to good health.
Yeah, and when I really looked into Dr. Chris Kenobi's lectures that you referenced in your videos, I want to talk about this a little bit, because certainly it's a passion of mine, being an eye doctor for 30 years and dealing with people losing their vision from it. When I really looked at his research, he is 100% positive that it is diet related, and he did 7 years of research. So I try to impart that onto my patients to make them understand. And in 1900, that there was like 1 in many thousands of people that was afflicted with this, that had a lifetime risk of macular degeneration, 1 in many thousands. And by 1990, it was 1 in 3 people. 33% of the population. Yep. And I tell people, it almost seems like every other patient that sits in my chair has at least the early signs or moderate or advanced macular degeneration.
Yeah,
And
and I know there's at least one healthcare provider out there right now saying, yeah, but back in 1900, 1910, we couldn't see the retina. No,
that's not
doctor.
true.
No, it's totally false. We had thousands of retinas that had been recorded, and they were, some of them were photographs, but the vast majority of them were optometrists and ophthalmologists taking their meticulous time and painting or drawing a picture of what this patient's retina looked like. They had beautiful ophthalmoscopes back then. I mean, they had that. They were invented, I think, in the 1870s, 1880s. And by the 1900s, there were 20 different brands you could buy. So no, don't think that. We knew exactly what the retina looked like in 1900, 1910, 1920. We had hundreds and hundreds of illustrations. Macular degeneration just didn't exist back then because nobody was eating the amount of carbohydrates they eat today. Nobody was eating the amount of industrial vegetable oils that they're eating today. But everybody was eating lots of fatty meat back then. So macular degeneration just didn't exist.
Yeah, and Dr. Kenobi went in for his research stating that it wasn't until about 1880 that white flour came about, and the seed oils and the trans fats, and that's when sugar consumption also increased. And the combination of that, prior to 1880, there was virtually no processed food, like none.
Right. It just didn't happen. Yeah.
It didn't. So it's just so frustrating because, just like you, I just want to get the word out and I want people to know. And I know so many people now that either their parents have it, their grandparents have it, their siblings have it, they themselves have it. And it's just so important to get people to understand. Now, the flip side is these processed foods and sugars and flours and carbs are so addictive. And that's a whole nother ball game that I'm also passionate to, try to help people with. So in any case, I'm just so grateful for at least your content that really helps me send my message out.
Well, and I don't think that the change is ever going to come from the top down. That's why I do as much social media as I do. Today, you and I on this live, we're going to reach from 2 to 15 people who it really resonates with. There's going to be a few people that go, wait a minute, what the hell? You're telling me that my grandmother is not doomed to get a shot in her eyeball every month forever, that we could actually slow that down or perhaps even reverse it? Let me go watch this YouTube video this kooky Dr. Barry's got. That can't be true. And then they're going to piddle around in the show notes and they'll find the research and they'll find Dr. Kenobi's excellent YouTube videos. And we're going to wake a few people up today. And we're going to wake 1 or 2 healthcare providers up who are sitting there right now going, this is bullcrap. This is not, your macular degeneration is either genetic or it's idiopathic, and that's it. That's what I was taught, and that's the truth of it. But 1 or 2 healthcare providers will go watch my YouTube video, and then they'll watch Dr. Kenobi, and then they'll look at the research and go, is this possible that this is true and I just was never taught this and I didn't know it? Is that really, can that be true in the world we live in? Yeah, it's true in the world we live in, but slowly but surely people like you and me are waking up patients and waking up healthcare providers. But this is how the change is going to come, from doing just what you're doing right now.
Yeah, and I'll tell you, I just became very well acquainted with Dr. Richard Orso in Houston Eye Center. I know he says he's familiar with you or has spoken with you. And so for all the viewers out there, he's an ophthalmologist in a huge practice, and he himself is now carnivore for, I think, about 3 years.
Yep.
And we had a great conversation last night just talking about mutually trying to get the word out to our diabetic retinopathy patients, macular degeneration patients about, and he literally prescribes, the carnivore diet in pretty much a stepwise fashion, trying to introduce them first to say, hey, stop eating sugar and flour, you know, as a first step. And then he does throw out the whole, gives them all sorts of references to carnivore sites too. So.
Yeah, and I think that's those first 2 steps are perfect, because you probably agree with this. If we could get every American to stop eating all added sugar and stop eating any processed grains, just those 2 steps alone would cut the macular degeneration epidemic in half. Just those 2 steps alone would cut it in half. So many grandmothers and grandfathers would not have to go get that monthly shot into their eyeball. And yes, I mean a shot with a needle into their eyeball. They wouldn't have to ever do that. And so many grandparents and great-grandparents will get the joy of actually watching their grandkids play t-ball or play soccer. They actually get to see that with their own eyes instead of having to have it described to them by a family member who's slightly annoyed that they have to give them the play-by-play because they can no longer see. Just those two steps alone, that's a beautiful first start. And then step 3 would be stopping all industrial vegetable oil, canola, corn oil, soybean, peanut oil, sunflower, safflower. Those things will really muck up the neurons in your retina. Those 3 steps will completely do away with the epidemic of macular degeneration.
Yeah, and the alternate disease of my frustration, diabetic retinopathy, the diabetes, and I feel the same way. I mean, it's a leading cause of blindness, and
Yeah.
it's so preventable. It's so very preventable.
Yep.
And I still have patients that sit there and say, really? I mean, it's almost like they feel like they'd rather eat the junk and take the insulin shot or the metformin pill than give up pizza or pasta or their desserts. And but you know what? I still feel like for the handful, or I think it's a growing percentage now of people that I really reach and make an impact on, that how important it is to change your diet and stop eating this junk, and they can really make a difference. And I tell people, next thing you know, it's an amputation of a limb and your vision's gone, and then where are you?
Right.
So it's choices in life.
Diabetic retinopathy is another malady that is completely preventable, both in type 2 diabetics and in type 1 diabetics. Every diabetic can use a low-carb diet, a keto diet, or a carnivore diet if you're type 1, to get your A1C back down to normal. And if you have a normal blood sugar and you're not having to overuse insulin, your risk of diabetic retinopathy is going to be slashed by 80 or 90%. If you're a type 2 diabetic, you can completely reverse that and get rid of that risk factor. There's nothing magic about being a diabetic that harms your retina. It's the chronically high blood sugar and also the chronically high insulin levels, and then the industrial seed oils. Those 3 things are what glycate the cells. They're also probably what lead to cataract formation. Those are the things that you can take out of your diet and out of your life and completely slash your risk of ever having diabetic retinopathy or macular degeneration.
Yeah, and I have some questions that people wrote into me prior to us coming on live, and then maybe we'll go on to the questions written here live. But
sure.
One of the things is they wanted to know if currently on a statin medication, should I stop taking it?
That's a question to discuss with your doctor. But if it was me taking a statin, I would throw it in the garbage today. If I was your doctor and you came to see me, I would either decrease the dosage of your statin or stop your statin. But obviously none of this is medical advice today, where it's just 2 doctors talking. But my grandmother, let's put it this way, my grandmother used to take a statin because her doctor didn't know better. I had a little chat with her and her doctor. My grandmother no longer takes a statin. Does that help?
Yeah, I always tell people I can't give medical advice, but I wouldn't take a statin if you paid me. So, everybody has to make their own decisions and do their own research. So, another person wrote, does blood pressure normalize on carnivore diet? And what about stopping my blood pressure meds?
Yeah, not every single person's blood pressure is going to return to normal on keto or carnivore. Only about 80 to 85% to 90% of people's blood pressure will return to normal. So you've got about an 80 to 90% chance that you'll be able to either decrease or stop your blood pressure medicines if you're eating. Now, when I say keto, I'm talking about a real food, whole food, 1 ingredient food, ketogenic diet. That's what I consider keto. I'm not talking about the keto shakes and powders and bars and cakes and pies and candy. I'm talking about real 1 ingredient foods if you're talking about keto. And then carnivore obviously is just lots of meat, as much meat as you want to eat. But somewhere between 80 and 90% of people who do one of those diets faithfully are going to be able to either decrease their hypertension medication or they'll get to stop it altogether.
Yeah, so I had a lot of questions on different particular things healing on
Sure.
carnivore, but another one, somebody said, have you seen asthma healed on carnivore?
Yeah, I've had people both eating a real keto diet and a carnivore diet get to come off all of their inhalers. I had one little lady who was on 3 different inhalers for what she had considered lifelong permanent asthma, right? And when she removed all the offending slow poisons, is what I consider them to be, from her diet, she came in and she said, you know, I really feel like my breathing's better. I would like to not refill those 2, but I refilled her albuterol just in case she had a flare-up, right? And then when I saw her 3 months later, because she was in her 80s, I saw her every 3 months. She said, you know, I haven't used my inhaler in 3 months, and didn't refill the other 2. So effectively, she became from being a chronic persistent asthma, that was her diagnosis, to being essentially non-asthmatic. Now, I'm sure if she got a cold or a bronchitis or flu, her asthma would act up, no doubt about it. But when she was in a healthy, normal state, and she was eating keto, not even carnivore, she didn't need her inhalers anymore. And in fact, I've had hundreds of people reach out to me online with COPD, mild to moderate, with asthma from mild intermittent to chronic persistent, say, is it okay if I'm having no symptoms whatsoever if I just don't use my inhalers? And I say, congratulations. Yeah, it's okay.
It's more than okay.
Yeah, absolutely.
Yeah, one of my favorite things to say to people is, you know, I've been doing this for 11 years, so I've been around a lot of people, a lot of forums, met people in person, and read a lot of testimonials. And one of my favorite things to say is I've really not come across too many things that carnivore hasn't cured.
Right.
So,
I mean, there are some genetic conditions that you have a literal genetic defect. Carnivore ain't going to fix that. But
yeah.
any of the chronic, persistent diseases of modern society, carnivore or a real whole food ketogenic diet is going to reverse drastically, if not completely reverse. And the list of conditions is quite long that I've had people reach out to me and say, hey, is that possible that keto or carnivore did that? I'm like, yeah, it's very possible that happens.
Yeah, and like things like Parkinson's, MS are pretty mind-blowing, bipolar, anxiety, and depression, but it just really goes to show you how all-encompassing an effect diet has on our bodies. So
absolutely.
Yeah. So another question was, can you please list blood tests to ask for at my annual physical?
I'm actually, I have a course on this that Kim Howerton and I are putting on, and the website is commonsenselabscourse.com. And I think it's $59, and you don't have to take the course. I'm happy to list them here. I may forget 1 or 2 because I'm spouting them off the cuff. But basically, if you're over the age of 30, 35, 40, and you have any symptoms of fatigue or insomnia, any menopausal symptoms, any of those kind of symptoms, then there's an absolute set of tests that you need. And I can't tell you all of them that you need because I don't know if you're a man or a woman. I don't know your age. I don't know your other medical conditions, right? But I can just go through a list. And so if everybody grab a pen and get ready to write, I'll just go through the list here. We'll do another question, then remind me so everybody's got their pen and paper or they've got their phone app out and they can record these labs. And then also this video, if Carnivore Doctor saves this, it'll be available for 24 hours so you can go back and watch the replay.
Yeah, definitely. So another question is, how much water is needed? I drink less water now most days and don't have much thirst. Is that okay? It's
100% okay. On keto or carnivore, you should eat only when you're hungry, right? But also another maxim of living a proper human life is you should only drink when you're thirsty. Okay?
That's what I tell people. It
Yeah.
drives me nuts when people say, "Oh, should I be drinking 1 quart per something body weight, or drinking this or that, or, oh, I drink a gallon a day, or I fill this up 3 times and drink it. I'm like, what for?
Why?
Your
Yeah,
body
why?
is so fine tuned
Yep.
to give you a sensation of thirst when it's time to drink. And
That
drink when
really,
you're thirsty.
that when we say something like that, that infuriates so many of the health gurus out there, because they love to give people this busy work of, oh, you need to drink your body weight in ounces of water a day, or you need to drink a gallon or 2 gallons. And I've looked into this extensively, folks. There is no research that shows that drinking more water than your thirst demands helps you lose fat, makes your kidneys healthier, cleanses your liver, all the baloney that you hear out there. None of that is true. Drinking too much water can actually be detrimental to your health. It can lead to things like hyponatremia if you get carried away with that. So if you're trying to eat a low salt diet and you're also trying to drink a gallon or 2 gallons of water a day, you can absolutely wind up in the emergency department from that with hyponatremia, which is quite a severe medical condition. Stop limiting your salt. That's dumb. Stop drinking extra water because some guru out there told you it was healthy to drink 3 liters or a gallon of water a day. It's just dumb advice. It's based on nothing ancestral that we've ever done as in our history as a species on this planet. There's also no meaningful research that backs that up whatsoever. It's just ignorant advice.
Yeah, and I tell a lot of my followers whenever I do lives and we have discussions about any sort of thing, I always say, just think back to ancestral man. What did he do? He wasn't carrying around a set amount of water and going to the spring to try to drink a certain amount. He drank when he was thirsty. Yes. I said, make it simple. This has got to be sustainable. And the simple it is, the more sustainable it is. So,
yeah, and that's a great advice. I mean, human 100,000 years ago couldn't be going to the bathroom and peeing once an hour. That would not be sustainable. You would get eaten by something if you had to stop and pee once an hour. That's not normal. That's not healthy. It's not good for your kidneys to drink that much extra water. That's not how we were designed to live.
Yeah. All right. So do you want to go through that list of tests and then
I'll
get to the next
All right.
question?
So let's go. And I might leave a few out because I'm going off the cuff here. But you need a complete blood count with differential. So a CBC with diff. You need a complete metabolic panel. Never let your doctor order just a basic metabolic panel. So you want a CMP, not a BMP. You definitely want a urinalysis. You want a lipid panel drawn, but you don't care about the total cholesterol and LDL. But you're very interested in what your HDL and your triglycerides are, okay? You want to get a hemoglobin A1C. That's going to tell you how your blood sugar's been doing the last 3 months. You want to get a C-peptide. That's going to tell you how hard your pancreas is having to work to squirt out insulin to cope with the amount of carbohydrates that you're eating. You want a TSH. That's a thyroid test. You want a free T4. You want a free T3. You want a reverse T3. That's going to help you, and that's going to give you a pretty complete thyroid checkup. If you're having any symptoms of low thyroid or fatigue or weight gain or being cold all the time, you also want a TPO antibody and a TG antibody. Let's see, we want to get some inflammatory markers. We want to check an ESR, which is a SED rate. We want to check an HSCRP, which is a C-reactive protein. What else do we want to check? We want to check definitely a GGT. Now, GGT gives you a good extra look at the liver over and above what the CMP did. It also is a good marker for cardiac and other problems as well. What other tests would you add to that, doctor?
Well, when you said GTT, you're talking about glucose tolerance test?
No, a GGT is an extra liver test that
I thought you
actually
said
looks
GTT.
It's an extra little look at hepatocyte health.
Yeah. No, I mean, that seems pretty complete. I think one of the most important things that I tell people about blood work is people are so anxious, like 1 month into carnivore, running out and getting blood work. And part of it is because their significant other or parent or whatever is saying, I want to see your blood work. This can't be healthy.
Yeah.
And you know, blood work kind of gets screwed up at the beginning when you're adapting to this. I said, I like to tell people to wait a year and at a minimum 6 months, but I really love to just say, you know what, what's going to happen in a year? You know, nothing but something good. So wait a year.
I totally get your point, but I don't mind if people want to recheck labs in a month or 3 months with the understanding that I don't care what happened to your total cholesterol. I don't care if it went up or down or stayed the same.
But they do, and their significant other does. And
then they need to go watch my YouTube video and they'll quit caring about that, right?
Yeah, that's true. That's very true. All right, the next, I'm going to read out a set of questions that are all kind of tied in together. So bear with me. Let me just get through a bunch of these, and then you can address it in probably a combined form. So can you eat too much meat for weight loss? Why am I not able to lose on carnivore? How much protein and fat should I be eating? Keto was less protein and more fat, and now carnivore seems more protein and less fat. Won't that make me regain what I lost on keto? Do I need to eat a gram of protein per pound of body weight if I'm trying to lose? So all of these are a big conglomerate of questions where, you know, I tell people don't measure and, you know, do so much technical stuff with this, but I'd love to hear your take on that whole.
So whether you're doing keto or whether you're doing carnivore, you luckily get to eat as much fatty meat as you want. Okay, there's no limit on the meat. The only macronutrient that I want you to really focus on is your total carbohydrate intake. That's the number that I do want you to focus on, at least for a month or two, until you've learned everything that has carbohydrates in it. Because if you're not a doctor, nutritionist, or dietitian, you may have no idea that some things are very carby. Like, for instance, I had a guy arguing with me on Twitter that grapefruit was keto because it was so sour and bitter, there's no way it had a lot of sugar in it. I'm like, dude, a grapefruit has 29 grams of carbohydrates in just a medium-sized grapefruit. Just because it's sour doesn't mean it's low carb. And he was blown away by that. He had to Google it to see if I was right. So focus on eating very, very low carbohydrate.
But what about addressing it for people who are really carnivore?
Yeah. And so then protein, I've never seen anybody eat enough protein to gain fat. Okay. Now, and so if you're wanting to gain fat, you need to eat more carbs. Or if you are gaining fat, then you are eating too many carbs by definition. That's how it works. Now, I've seen many people when they convert to a carnivore diet, they're like, Doc, I've gained 5 pounds, but I've went down 2 dress sizes. Or, Doc, I've gained 7 pounds, but I'm having to go in an extra loop on my belt now. So how is it possible that I'm gaining weight on the scale, but I'm obviously there's some kind of body transformation going on here? What's going on? Human beings, by their nature, if they eat the proper human diet, are muscular creatures. Okay, you have to understand that. And there are many carnivores out there who will raise their hand and voluntarily tell you, yeah, when I started eating carnivore, I started putting on muscle even before I started working out. And many, many people have told me that that their thigh muscles, their butt muscles, their shoulder muscles, back muscles, like I look like I've been working out, but I haven't. And I had multiple patients accuse me of that when I first started carnivore. They're like, oh, you've been working out. I was like, actually, no, I haven't been working out at all. You just naturally hold more muscle when you're eating the proper human diet. That's okay, because what we're all concerned with is gaining and losing fat. I don't think anybody out there is concerned with, oh my God, I gained a pound of muscle, I'm so sad. No. And then a lot of people, they're still thinking the Weight Watchers way. I just want to lose weight. I don't care what it is. That's actually not true at all. You definitely don't want to lose muscle mass. It's very unhealthy, especially when you're especially when you're over 50. If you're losing muscle mass from a diet, That's very concerning. That's not safe or healthy at all. Are you losing bone density from doing a calorie restriction diet? That's also very concerning and very unhealthy. When you're eating a carnivore diet, you might put on some muscle, but your belt's going to keep getting bigger and bigger, or your dresses are going to keep getting bigger and bigger. That's very common on a carnivore diet. So I wouldn't focus so much on what the scale says. I would measure myself like I'm getting measured for a dress or a suit of clothes, and then check those measurements once a month, because you might put on some muscle, but that's a good thing. That's not a bad thing. And a lot of people are still afraid of gluconeogenesis, because early on, when keto and carnivore was becoming popular, people thought that you could overeat protein to the extent where you would actually just force your liver to be pumping out glucose. Absolutely not true whatsoever. Your liver is designed to make glucose when you need it. You can't eat enough protein to force your liver to make glucose enough to gain fat. That just does not work that way, okay? If you're eating enough protein to do that, you're going to be satiated very quickly, and you'll stop eating because you'll be repulsed by eating another bite of protein. Now, if you're using protein shakes and collagen shakes and branched chain amino acid shakes, you might be able to drink enough protein to gain fat, because very often they have hidden carbs in them that they didn't tell you about.
Yeah.
But if you're eating meat, I have yet to see a single person, and I've put up the challenge. I'll pay anybody $1,000. Come to Tennessee. Let me lock you in my barn. You can eat as much ribeye, beef, as much ground beef, bacon, butter, and eggs. I don't care. You can eat as much as you want. I want you to try to gain fat. We're going to do a DEXA scan before I lock you in my barn, and then I'm going to give you a month. I'll pay you $1,000, and then 1 month later, we'll do a DEXA scan again, and if you have gained body fat percentage, I'll give you $1,000. I don't think anybody's ever going to take me up on that challenge, because it's impossible to gain fat by eating fatty meat. Your body just doesn't work that way.
Yeah. So in that sort of line of question, somebody writes that they're 6 months carnivore and they absolutely love it. Everything's going great, but now the scale has been stuck for the past 2 of those months. Mm-hmm. And they have limited dairy and they have no sweeteners and they're looking for help.
Good. So first of all, if this is a man or a woman over the age of 40, congratulations, because you haven't gained any weight in 2 months. Think about that for a second. What's normal for a man or a woman who's 40 or 50 or 60 years old? On average, they gain a pound every 3 months, right? And most of us gain a pound a month if we're just eating whatever. So first of all, congratulations. We call it a stall, but that's actually that would be a victory for the average person, because you haven't gained
maintenance.
It's called maintenance. Yeah, you maintained for 2 months. Congratulations. Plus, you're making your body healthy in so many hundreds of ways by eating the proper human diet. Now, if you're over the age of 40 or 50, there may very well be an undiagnosed thyroid condition. There may be undiagnosed sex hormone issues that you need to get addressed by a doctor who's knowledgeable in how to address those situations. Or there may be a spice or a rub or a sauce that you think is zero carb that ain't zero carb. I see that a lot in the carnivore community. You may think that you're eating occasional cheese, when if you started writing it down, you're eating occasional cheese every meal. And I'll tell you guys, cheese has to be an occasional treat for me on carnivore, or I'll start to gain weight. Heavy cream's the same way. I love it. I love the stuff. I used to have a little coffee in my heavy cream, but now I have a little splash of heavy cream in my coffee on Sunday morning. That's how I get wild on the weekends now, okay? Because if I had heavy cream every day like I used to and cheese every day like I used to, I would not be at 235, which is the lowest weight I've been in the last 25 years. I would have more fat than I have on me currently.
Yeah. Yeah, I have to agree with that with the cheese. I have a love-hate relationship with it, and if I'm going to be trotting around in the bikini, the cheese has got to go.
That's right. Absolutely. Yeah.
Yeah. So I guess I'm going to scroll through some questions that have been coming up on the screen. I'm going to try to head back up to the top just so I can catch everybody's questions, and we'll try as best we can to answer as many as we can. Any recommendations for cold urticaria? I go outside and when I come back in, my face swells with temperature change. Very frustrating. Thanks.
Yeah, it depends on your diet. I'd have to know what your diet is. But if it's not a carnivore diet, I would recommend that you try a month of carnivore. It's very. I actually have rosacea, and that can be a symptom of rosacea. So usually it's hot liquids or getting sweaty or hot, but also sometimes cold can trigger that as well. There's various different kinds of eczema and urticaria that can be triggered by cold. But you have to understand, human skin has been exposed to cold temperature since the beginning of time. That's not something new. That's not something you should be reacting to. What's happening is there's something in your diet that's keeping your immune system on a 9, where all you need is a 10 to have that reaction. You've got to figure out what's in your diet that's keeping you just on the verge of being inflamed. Remove that from your diet, then your inflammation is going to go back to a 1 or a 2 or a 3. Then you can go out and play in the cold, and that won't happen anymore. I used to think that my rosacea was just genetic. I'm just stuck with this. You know, my grandparents had it. My mom had it. I'm going to have it. Actually, not the case at all. Since I've been carnivore for, 15 months now, I have 0 rosacea whatsoever. Just did a YouTube video about it if somebody wants more information. But all of the skin conditions like that just go away with carnivore. Sometimes they go away on keto, but sometimes it takes that extra step of being a carnivore for that kind of skin condition to go completely away.
Yeah. There's somebody who writes, what about fatty liver as diabetes type 2?
Yeah, that you 100% need keto or carnivore. I don't care which, keto or carnivore, either one reverses fatty liver and reverses type 2 diabetes faster than any pill or injection your doctor can prescribe you. In fact, there is no medication on the planet that can reverse fatty liver, but keto can do it, and carnivore does it 100% of the time, unless your fatty liver comes from too much alcohol, in which case we all know what you need to do. I don't even need to say it, do I?
No.
Yeah.
All right, somebody wrote, they just showed their mom Dr. Berry's videos on type 2 diabetes, and they slowly be swaying her.
Beautiful,
So
beautiful. And I think that's one of the reasons I make all the YouTube videos is quite often your mom or dad or grandparent, they ain't gonna listen to you because they used to change your naked little butt when you peed your diaper. You don't know anything. You might be an optometrist, but I guarantee you your mom and dad are like, whatever.
My parents don't listen to me,
right,
Kim.
exactly.
They don't.
It's called.
My parents are diabetic.
Right. It's called powdered butt syndrome. And so I think that having a doctor, oh my God, here's a doctor on YouTube, listen to him. They'll listen to me, where they won't listen to you because you've got powdered butt syndrome. And I think that's one of the reasons my videos have helped so many people, is that people share them with their uncle and their aunt and their grandparents and their mom and dad. They're like, I saw this doctor on YouTube talking about type 2 diabetes. And their mom or dad might just literally watch every video I have on YouTube. And then the funniest part of it is, then a month later, the mom or dad, they're trying to teach their kid about keto. And the kid's like, yeah, duh, that's what I've been telling you for a year.
Oh, so another viewer's writing, thank you guys so much. Would love tips on how to get my wife and 2 boys on board, 5 and 7 years old. Youngest has asthma.
Yeah. Oh my God. So 2 things come right off the bat. First of all parents and children of parents need to be leading by example. First and foremost, if you're keto or you're carnivore, if it's not literally transforming your health and your life, then nobody's really going to be impressed when you say, hey, you should eat keto or carnivore. But if they look at you and go, my goodness, you look different, you look better, you look slimmer, you look more muscular, their curiosity is immediately going to be spiked. And this works for kids too. I've got teenage daughters, well, 2 now, one's in her 20s. My teenage daughters are both keto now, not because I browbeat them and forced them and was the keto Nazis. They kept watching me and Nisha get healthier and healthier. They kept watching me become a more pleasant dad, not just a chronic grouch who's always mad about something. They saw this transformation in me. Kids are hardwired to see that. That's why the kids of smokers wind up being smokers, even if they hate to smoke when they were a kid, because you hardwired them. They saw your example every day for years and years. right?
Yeah, and
So
I think for that guy, getting his wife on board by maybe sitting her down to watch Dr. Berry's video on
maybe,
asthma,
yep. But
and maybe,
he needs to be cleaning off his doorstep first. He
yeah,
needs to be having to buy all new clothes because he's lost the fat. He needs to be stopping medications because he's reversed his blood pressure and his pre-diabetes. But then parents have to understand, unless your child has keys to the car and a credit card and a copy of your ID, they can't buy groceries, right? They don't get to vote. When you go buy groceries, you can forget the Oreos. Oh, I forgot the Oreos, but I did get you some blueberries. See that? And then you forget to buy the Oreos forever and ever and ever. You never buy them again. And then the next trip, you can forget the Doritos, but you got them some meat skins. Hey, they're even barbecued. Try them out. See if you like them, right? And then you never buy Cheetos again. Then the next trip, you forget the ding dongs or the honey buns. Oh, I'm so sorry, I forgot.
no dessert tonight. We're going to have blueberries.
But I did. I got some fresh strawberries and I made some homemade whipped cream. It's so good. And you never buy the honey buns again. And you keep doing that, and before long, your kitchen is a keto kitchen, and there's never been a single fight. You never had to lay down the law or clean the house or have a fight. Be a ninja parent. You don't have to have fights for no reason. Pick your fights. But when you go to the grocery store, you're in charge. You're the one with the credit card. You get to vote.
Yep,
It's that simple.
It is very simple. It's easier said than done, but it actually can be done. So
absolutely.
That's
and then another great strategy is if you have a teenager, if they have acne, you know, I saw this YouTube video. This doctor was saying that keto would make your acne go away. You should check it out.
Yeah, I've got great before and after pictures. It's actually on my Instagram if anybody wants to check it out.
100%.
I had acne all on my neck, and in literally 2 weeks after giving up flour and sugar, I have a 2-week after shot, and it was an incredible difference. So
if your youngster is overweight or obese, there's this YouTube doctor that says keto or carnivore can help you lose the fat. This is not mom or dad telling you this. This is just you. And you know, most teenagers think YouTubers are pretty cool for some reason. I don't know why. But if they hear me say it, all of a sudden they're going to be teaching you about, hey, keto helped me lose all this fat, just like Morgan Berry. Now she's got her own YouTube channel trying to help teenagers understand that you don't have to be overweight. It's your diet.
Yeah. All right, I have somebody else commented. I thought, I think they were talking about macular degeneration was genetic. My grandfather and father, and I thought I was doomed. So
nope.
There's
watch my YouTube video. Watch Dr. Kenobi. Is that how you pronounce it?
I believe so.
Yeah, I was calling him Dr. Knob, so I'm glad you said that before I did.
I tried to listen very carefully when somebody introduced him on one of those YouTube videos because I wanted to be able to pronounce the name correctly too.
I think I have 2 macular videos, and he has deep into the science. If you have a grandparent or a parent with macular degeneration, listen carefully, you are not doomed. No, you can literally reverse your risk back to baseline by removing the slow poisons that I talk about in those 2 YouTube videos. You do not have to have it.
Yeah. Let's see. How long is the recovery? My mom is legally blind in one eye, not on any other meds, save high blood pressure.
Yeah, so you might be a better one to answer to this. My answer to that would be it may be too late for that eye.
Yeah, I always say that the worst case scenario is you halt the progression.
Right, that's right.
So
100%. There may be some improvement possible, but what we're talking about, the retina of the eye, it's basically neuronal tissue. It's an extension of the human brain. It takes the brain a very long time to heal. And then therefore, by extension, the retina, it takes it a very long time to heal. And then even Dr. Kenobi says, you know, after you've progressed to a certain level, there's probably no coming back from that. And unfortunately, I tend to agree with that. It's like after you've had a huge stroke and you can't even move one side of your body. And then you say, well, will keto fix me? Probably not at this point. No, you're not going to regain all that function. So if you're already to the point where you're legally blind, you might be able to improve the vision a tiny bit, but probably not back to normal ever. But who I'm talking to is people who have the earliest stages, or they have a family history and they think they're doomed. You absolutely can stop the progression right now. Starting today, you can stop the progression in its tracks. And if you're in the earlier stages, I think you can damn sure reverse that. Yes.
Yeah. Yeah, I think the early stages would definitely be reversible. And I talked a bit with Dr. Urso about cataracts, because so many people have been asking, is that reversible? I say a similar thing as far as I think it might slow the progression. Cataracts are one of those things where it's an inevitable change of the eye. And the flip side is it's such a safe, painless, easy, remarkable surgery that's not something to fret. I mean, it's not like macular degeneration.
Right.
I mean,
Right.
It's so easily correctable, but
Yeah.
and
I fully believe the cataracts are at least in part due to glycation. And so, I mean, yeah, could you reduce the severity of your cataracts in the future? So I'm talking about, so if you're a person in your 30s, 40s, 50s, and your parents have terrible cataracts, again, I don't think you're doomed to that. If you fix your diet today, you might wind up with very mild cataracts that never have to be acted on. But if you keep eating the carbs, yeah, you're probably going to have them too. And you'll have to have the procedure. And it's a very elegant procedure, and it's quite painless, but I'd rather avoid that procedure. Also, if you please, I'd rather not even do that.
Yeah.
Let's do one more good question, and then I'm going to have to jump off. I've got a YouTube live coming up at 5 p.m. Central with Dr. Anthony J. We're going to be talking about plastics and hormones.
Oh, yeah, so that'll be interesting. Oh, great. I'll be looking forward to hearing that. Somebody wrote, I'm in remission of lung cancer. How concerned do I need to be about COVID-19?
You need to isolate yourself. You need to stay away from everybody. You need to take all the precautions that I talk about in my two YouTube videos about COVID-19. Although they got demonetized, I'm still happy I made them because they've helped a bunch of people understand this. Go watch those two videos. If you have any lung condition, you need to stay home. You don't need to be going out in public at all, and you don't need a bunch of people coming in the house without following the steps that I outline in those two videos.
Yeah, great. All right, thank you so much for coming on, and this has been great. I've been looking forward to having a face-to-face with you for quite a while.
Absolutely.
And hopefully we can do it again in the future.
Yeah, it's my pleasure. We absolutely can do this again sometime.
Great. Thanks so much.
All right, ladies. See you next time.
Bye, everybody.
Bye-bye.